Have you ever wondered how doctors can tell if you have been exposed to certain infections, even if you do not feel sick? Well, for tuberculosis, or TB, one common way they do this is with something called the Tuberculin Skin Test, often shortened to TST. This test helps medical professionals determine if your body has ever encountered the bacteria that causes TB. The TST is a clever way for your immune system to reveal its past encounters. When you receive a TST, a small amount of a substance called tuberculin purified protein derivative, or PPD, is injected just under the surface of the skin, usually on your forearm. This PPD is a harmless protein extracted from the TB bacteria itself, but it cannot make you sick. If your body has previously been exposed to the TB bacteria, your immune system will recognize these proteins and mount a local reaction at the injection site. This reaction is a delayed hypersensitivity response, meaning it does not happen immediately but typically takes 48 to 72 hours to develop. The size of the raised, firm area, called an induration, is then measured by a healthcare provider to interpret the result, not just any redness or bruising. It is important to remember that a positive TST result indicates that you have been infected with TB bacteria at some point, but it does not tell you if you have active TB disease. You might have what is known as latent TB infection, where the bacteria are present in your body but are inactive and not making you sick or contagious. A healthcare provider will carefully evaluate the size of the induration, your risk factors for TB exposure, and your medical history to determine if your test is positive. Factors like having been born in or traveled to areas with high TB rates, or having certain medical conditions that weaken the immune system, can influence the interpretation. If your TST is positive, further tests, such as a chest X-ray and sputum tests, may be needed to rule out active TB disease. This is because treating latent TB can prevent it from progressing to active TB disease, which is much more serious and contagious. Understanding the TST helps you see why it is a valuable tool for early detection. It empowers doctors to identify individuals who could benefit from preventive treatment, stopping the progression of latent infection to active disease and protecting both your health and the health of your community.